everyone, my name is Catherine and you're welcome to this video. On this video, I'll be talking about things you do not need and the things that you need to process your healthcare assistant visa pathway. I've been seeing quite a lot of videos about that and some people are really worried, they're asking questions, and I'm just going to be going straight to what you really need and the things that you don't need. But before I go on, I would like you to please click on the notification button, to get regular updates from me, and most importantly to me, please subscribe to this channel. On this channel, I share relevant tips on lifestyles, immigration, nursing. So if it's your first time on this channel, I will say you're welcome, and please don't forget to subscribe. Okay, let's get to the video. So I'm talking about the things that you need and the things that you do not need to process your healthcare assistant pathway. So the things that you need basically are: one, you need to be educated. You need to have at least a whole level, like maybe WAHEC, NECO, GC. You need to have O levels, and I'm not talking about having like F9s or D7s. It has to be a good one, very good one, not like very good one. I'm not talking about A1s and all of that, but at least have credits and all. So you need to at least be educated. The minimum educational level should be O levels. Then if you have another diploma, or you have a degree, or you have another certificate like a tertiary, an advanced certificate apart from the O level, that is also a plus. It's also a plus. So whether you are that certificate is health related or not, it is a plus. It is a plus. Kindly note that. So it doesn't mean that you have to maybe have a certificate in any health related courses. Even if you don't have any certificate in any related courses, it is totally acceptable. So after that, you need to have your Nigerian passport, your international passport. Definitely, that's what you use to travel. So you need to try and get your international passport. When you get your international passport, then you need to register for your IELTS examination. I'm talking about the test of English. And I think the minimum requirement for healthcare assistant or senior carer pathways is a band 5. So you need to have at least a band 5 in all the modules. Like your modules total has to be a band 5. You can't have less than that for the IELTS. Okay. Then you need a good CV. After you get your Nigerian passport, you're at least educated, you register for your IELTS examination, then you need a very, very good CV. Something that will sell you out, a standard CV. Now, this is your CV. I'm stressing it because there are people who they don't have any certificates in health. Maybe their degrees in accounting or in economics and all of that, and they're feeling can I actually apply for this job? Yes, you can apply for this job. The only thing they might want to see is that, okay, do you have experience maybe in taking care of people with needs? Have you done it before? Have you worked in the health sector before? Have you ever maybe been maybe health assistant? It might not be in a formal setting, maybe in an informal setting, and you were involved in care of an elderly, you've done some voluntary works. All of these things can be put in your CV. Okay, so let me talk about the things that you do not need. You do not need, and I'm going to say this with all confidence. You do not need to be getting any of these certifications that some agencies or agents are, dishing out there for you to get an healthcare assistant certificate for 500,000, for 250,000. Please save your money. You don't need any of those certificates to actually get you the job. I am not also sure, like, I've seen a lot of people with no experience getting this healthcare assistant, senior carer. Okay, maybe not for senior carer, but at least healthcare assistants jobs. So with no single experience. But for people with senior carer, maybe people that have been already exposed into the health sector, they know what is expected, they've been there before, they know what to do. And trust me, the kind of setting they have in the UK is they will groom you, they will train you, they will give you all the help and all the support that you need. They might try to assess your base, like, okay, what's the baseline knowledge of this individual? When they assess that, then they'll be able to know what kind of training, what kind of help, what kind of knowledge do you need to acquire. So I will say that you don't need to get all of this healthcare assistant certificate. It's not needed. It is totally not needed. If you're not sure about what I'm saying, you can try and call up they are quite so open here. You can try and call up some of these agencies that recruit healthcare assistants, whether you actually need a special certificate that says that you are well trained in assisting, or I don't know, you find out that it is actually true that you don't need it. So if you don't have the money for it, please save it. But of course, if you just feel like you are curious, you want to know what is expected of you, and you want to, maybe, you have that money really, then you can actually spend it. I'm not saying you cannot spend it. I'm just saying that it is not a very important requirement or important certification that you need to acquire. Definitely not. Another thing that you do not need, for me, that I've been seeing some people, talking about, is that you don't really need to say you must have an experience. If you want to gather experience, you can actually still do. You can decide to go to maybe a private hospital and say, okay, I really want to help you guys. I just want to, and just volunteer. It's something you can actually add in your CV. There is no issue about that. But that you have to have the experience in taking care of people, or that you've actually worked in the health sector before, is not so important. It's not like it's a cogent requirement for this pathway. Of course, it is necessary, but they also take people with no experience. You can try to search a lot of videos, or even try and research. You'll see a lot of people working as a healthcare assistant with no single previous experience in the role. So I'm just trying to say that you do not need that. You do not need to say you're having a experience, or you're trying to get all of these things, or getting your certification. Another thing that you don't need is that you don't need any agent to help you process it, except you don't have the time and you feel or you are not so good with all of this processing, like submit this one, submit that. Then fine, you might be able to say you want to just give out to an agent to help you take care of everything. But it's something you can do from the beginning to the end. It's really very open and transparent here. You can work all your visa, you can do all your processing yourself. All you need to do is, when you get all the things that you need, you start searching for a job. There are a lot of websites where you can search for healthcare assistant jobs. So you start searching for jobs. It might be on NHS, it might be on tracs, you might be on Indeed. I might try to just put all of this websites, or should I say online platforms. Yeah, it's a website where you can apply for these jobs. So you need a good CV. Then you start submitting them. When you submit your applications, you make sure that your CV especially must sell you out. Remember, the employer is not seeing you. So the employer, whatever the employer is seeing on the CV, is one of the things that the employer is like, okay, it's giving you an idea of who you are. So you need to make sure that your CV is on point. And I will say, if you do not know how to write a CV yourself, you can actually give it out to someone to help you write it. But if you want to write it yourself, I also have a video. If you check my videos, you see one of the videos where I talked about how to write a standout CV. So if you can actually do that yourself. Make sure that you put all the CV, very good one. Your supporting statement is also on point. So when you submit all of these CVs, just make sure that you're also very available for your interviews. At least you need a very good phone, because most of these interviews are always on maybe Google Meet or Teams. And yeah, I think Teams and Google Meet, I don't know. There are other platforms that they may be using, so they will let you know if you need to download the app or anything. So you also need a good phone, and your phone has to always have data. Like, you cannot try to miss any mail, because these people, they read their mails. Believe me, they read their mails and they really respond. So you can reach out to all of these agencies. You can apply on the websites, like job application websites. You can apply there. You can apply directly to some agencies that recruit HCAs. Another thing that I would say that is totally not necessary is that you don't need to pay any agents. Like, oh, I'm bringing you over. And I'm seeing some people saying that some agencies were asking them for like 4 million, 3 million for you to actually get the job. And that's why I'm really emphasizing it in this video, that this is something you can do by yourself. You can do it all by yourself. Your visa application, it is really, really so simple now. So your visa application, your flights booking, you can all do all these things by yourself when you get your job. You can also apply directly when you get your job. But yes, there are some agencies that have been really, really good. They are not all about the, they take some money, and you, when you think about it, it's actually still worth the stress. You get me the job, and I just and you get me the job, and I pay you for something. For as far as the money is really not exorbitant, then I would say that's fine. But when it's coming to 5 million, 6 million, oh, that is outrageous. So that's why I'm just saying that these are things that you can do yourself. So I've spoken about the things that you need, and I've spoken about the things that you do not need. If you have any question, you can just let me know in the comment section, and I hope that I've made this as straightforward and as simple as possible. And thank you very much for staying to the end of this video. Please don't forget to like, hit on the notification button to get regular updates from me, and also please subscribe to this channel. Thank you very much for your time, and bye.